$15,000 over the course of 3 days of work, caring for the sick. And that income is just purely based upon his hands-on with patients. So $5,000 a day is what he was earning in an emergency room to care for the sick. This enrages me so much. And the reason why is that it's the quiet part that's being spoken out loud. I can look at this doctor and say he is the source of all that is wrong in medicine, but it is not true. He's just trying to get a piece of the pie. So I would just say he's contributing to it. But is he really in medicine to care for the sick? Is he really in medicine to care for his fellow man? This is dramatic. I'm sorry. Why are we here practicing medicine? Why is he here practicing medicine? Medicine is broken. And this is just one glaring representation of it. $5,000 a day he earns. I don't begrudge someone their income. I can't. It's not all right. But I do have an issue when we are driven by profit, because this is where people are harmed. This morning I was at Costco, and there was a person in line at the pharmacy, and their insurance wasn't covering the copay because the doctor had to extend the prior authorization or something. It was for $105 for the medication. I know that's a lot of information for me over here when I heard it, If you go into the room as a doctor to care for a person because you are there to care for a person, you're practicing medicine. If you're bouncing around hospitals to make a buck, what are you doing? Now, I know if you're a physician who's in the hospital system that you see how much the hospital brings in, you want to get your fair share of it. I can understand, well, they're getting the money already, so I just want my cut of it. You're still part of the problem. You still are part of the problem. Because we all know the care that people receive in these settings is, there's a lot of holes in it. Let's put it that way. So a lot of money is being exchanged in these places. A lot of care is not being provided. Who can afford a doctor at those rates? Only the most wealthy. And is that why we're here to practice medicine? Does he need $5,000 a day? Is that necessary as a physician? Because if that's his rates, how many people can afford to see him? I think when medicine puts profits first at any level, administrative or the care provider, doesn't matter, that we fail. That's a recipe for disaster. And medicine over the past 30 years has been pushing in that direction more and more, with ideas on how to optimize output and to streamline operations, which are all important things to do. We want to optimize that output. We want to streamline operations. We want to make sure our patients get the best care humanly possible. We want to make sure that's delivered in a clean delivery system with as few mistakes or lapses and with the best price points economically possible. But when you're doing that from an economic perspective, it's so easy to slip into, how can I tweak this to make even more? And now you're starting to look at the dollars rather than looking at the person. If you saw that reel just now and you felt sick to your stomach like I did, share it with me below in the comments. If you have seen reels like this from physicians acting badly, share them with me. Again, I don't begrudge people making an income. You should. We should all make an income. The amount of years I had to set aside making money, 8 years, and going into severe debt to become a doctor, I don't begrudge an income. But when you're making $5,000 a day, I think that that's excessive. So let me know what you think.